West Texas news and talk. This is the voice of West Texas. News Talk 550, KCRS.
Good morning. Welcome to your morning drive. News Talk 550, KCRS. It's the voice of West Texas. I'm Chris Moore. Joining me in studio this morning, Dr. Richard Bartlett and Alex Watkins. We got Siri joining us also this morning as a special guest. Good morning, you two.
Good morning.
Alex, thank you so much for coming in this morning. Of course, throughout this, with Dr. Bartlett coming in a year now talking about COVID-19 and, of course, his treatment with budesonide and how successful and what an adventure it's been. But he's always talked about you. Always talked about you, sent people your way because you embraced his treatment, and you've been using it in Big Spring for a year now. Kind of talk us through the whole process and what you've seen with the patients you've treated.
Sure. It has been a year. I've been treating people in Howard County, statewide, and also nationwide. So it's really kind of sent out some feeders for me there. And I became a believer in this treatment, not only because I believe in Dr. Bartlett, but I also got the chance to do some pretty in-depth research about budesonide and why it would be a beneficial drug therapy for a disease such as COVID-19. And so because of that, I was able to hit the ground running from day one, and it has just proven to be very beneficial from day one. Currently, right now, I ran some numbers yesterday evening, and I'm looking at about 2,800 patients, a little over 2,800 patients that I have treated successfully with budesonide. So it's an inhaled steroid. And the reason why it's been so successful is because we look at COVID-19 as a inflammatory respiratory disease. Mm-hmm. We have other disease processes like this out there, such as asthma, COPD, things of that nature. And then also in my research, I found that it was successful therapy for the SARS virus in 2003. So we had a little bit of history behind us, and then we also know how other inflammatory respiratory disease processes work. And so it just really gave me that good foundation to, like I say, hit the ground running from day one. And so we've just been very successful with it thus far.
And I forgot the number now. How many? 2,800?
Over 2,800 patients so far, nationwide.
Okay, from the beginning till today, can you tell a difference in people? Are more people coming in and getting treated as from the very beginning when they were telling them please stay home until you're almost dead?
There has been a shift. In the beginning, patients were told that there was no treatment, and so usually when I would get a phone call from them for a telemedicine visit, they were in 10 days, 11 days, 12 days. And with any kind of inflammatory disease, inflammation just keeps building and building, and it's not going to get any better until you stop the bleeding, essentially. And so in the beginning of this process, it was very tough. I was fighting an uphill battle with almost every patient because I was getting to them, a week in or a week past into the disease process. So over time, I've had the privilege of going and lecturing, just educating people about what COVID-19 is, that we do have therapies, we do have treatment that is successful, believe it or not, what some people may tell you. And because of that, I've noticed over time I started getting more and more phone calls where people were, in the first 24, 48 hours of the disease process versus 2 weeks. And so because we were able to start early aggressive treatment, I noticed I wasn't fighting an uphill battle, and patients were very successful with this. We were able to protect their lungs even more so because it didn't get to that, severe inflammatory state. And so, yes, I am starting to see that trend where more providers are coming on and using budesonide as a therapy. I believe on budesonideworks.com we have a list of providers that have embraced this therapy and have seen it work for themselves. I'm sure I believe there's some providers on that website that are in the 2000s as well, just like myself.
Okay, we now are talking that there could be possible other variants that are coming out, and we've had phone calls on it, even though they're saying that the vaccine, now that there's 3 available, will probably help to combat it. Do you think budesonide is also going to be able to combat the new variants?
I do, because this disease process, so SARS-CoV-2 causes COVID-19, the disease. Okay, so we are looking at SARS-CoV-2, but mutated forms of it. And we know as healthcare providers that viruses are constantly mutating. That's why they're so difficult to treat, and that's why it's so difficult to find cures for them and things of that nature, because they're evolving. So I believe that most providers, when this disease started, we had the understanding that there were going to be mutated forms. So when I do an education piece, I always explain that that SARS-CoV-2 is the virus that causes COVID-19, the symptoms that people present with. So we will continue to treat those mutated forms with steroids, inhaled steroids like budesonide, because it's still going to decrease that inflammatory response, thus giving the patient a more successful bout with this disease process. So yes, we recognize there's mutated forms. Yes, we understand that that's part of how viruses work. But so far, there's no need to change the protocol up, because the virus still causes the same symptoms, and that's what we're treating. We're treating the patient.
Well, let's talk from the very beginning, in case anybody is listening right now and they know that their friend has just been exposed to COVID and it's not real clear on what they need to do. So, as a provider, medical provider, what is your advice for someone that has been exposed to COVID-19 or is experiencing any kind of symptoms?
Sure. So with exposure, typically when a patient calls me and they can get a hold, they have our information on the website, budesonideworks.com. But they will call and we'll set up a telemedicine visit with them. And I go through a series of questions because of that exposure. If I find that they're not symptomatic and that exposure was very limited, what I've been doing is starting them on a drug called ivermectin. And this drug has been proven to be beneficial pre, during, and post-COVID exposure. Dr. Corey presented this information to the Department of Homeland Security in November, and he had a pretty good caseload of patients that he used ivermectin with and had a very successful bout with it. And so for those patients that have been exposed, very limited, not symptomatic, I start them on ivermectin because it's a very low-risk, high-reward drug. It's metabolized by the liver. It has only one contraindication with medications, and that's a drug called Coumadin or warfarin. A very limited amount of people on that drug these days. And so anyways, that's why I say very low risk, high reward for somebody that's been exposed. Now, if they've been exposed and it was for a long period of time, or say they're a caregiver for somebody that has COVID and they're producing symptoms, we will get them started on the protocol because, again, this is an inflammatory respiratory disease. So the earlier we can protect the lungs, the better off the patient. So if I have a patient that's symptomatic, I know from a healthcare provider standpoint that this is going to progress into a severe form if we don't stop it early. So the goal is to get them on treatment early. We start them on budesonide, the inhaled steroid, and I also am putting people on ivermectin as well with it when they're symptomatic. And we are driving down the opportunity for damage to the lungs from an inflammatory standpoint. So they would set up a telemedicine visit, and we would decide which path we would go. And the way I set up the way I have set up my practice with this is I will continue to follow the patient for 10 days, whether it was light exposure, heavy exposure, symptomatic, whatever it may be, because I don't want them feeling like this is what you have and just go on down the road. So it's a very intimate relationship between healthcare provider and patient, so the patient always feels like that they have hope and that they have what they need to be successful against this disease process.
And And see, I love the telemedicine aspect of it, so people can feel comfortable, because they're scared. Where do I go? What do I need to do? Do I need to go to an emergency clinic? Do I need to go to the emergency room? Do I need to call my doctor? So you've made this so very easy. It doesn't matter if you're in Big Spring, Odessa, or you said you've treated people all over the United States, as has Dr. Bartlett. So that makes it so much easier for folks that have those questions and those concerns about COVID-19. Now, if they are more in an advanced state, do you continue the budesonide treatment, like if they are having by some horrible chance to have to be on a ventilator?
Yes, I actually had a patient. I had treated a family, about 6 of the family members, and they reached out to me. They had a family member in the hospital in Alabama, and this particular family member, they called the family and said, she's going to be intubated in 12 hours, and I think we need to call the family, and we've seen this case. She's not going to make it. And so, of course, I had this family reach out to me, and graciously, the doctor that was caring for her, heard me out, and I just pleaded, can we please try budesonide with this patient? This patient was on other medications and other steroids, but unfortunately, they just were not helping the respiratory status. And so that's why I say graciously, this doctor heard me out, and he said, we'll do it. After the first breathing treatment, the patient started reporting she felt like she could breathe better. This happened 7 days ago. Today, she is on room air, and she's getting ready to leave the hospital. Yeah, so we went from...
Yes, it is. And good news, Dr. Bartlett.
Yes.
Good news.
It is good news. And so Oxford University just came out with a study. Oxford is the oldest university in the English-speaking world since 1096. 72 Nobel Prize laureates. They might know what they're doing, and they came out with a randomized controlled trial, the creme de la creme, top shelf evidence of medical facts and science, showing that early budesonide treatment for COVID, specifically for COVID, can decrease hospitalizations by 90%. 90% success with what our message has been since day one. Alex actually co-authored a paper with me a year ago explaining this. 51 referenced articles. It's not a new thing that we have evidence. We had evidence a year ago, and we even said 2 + 2 = 4. We put 51 cited references from JAMA, from NIH, from many reputable sources, all together in one paper so that any doctor or nurse practitioner or physician assistant could read it, or a patient could read it and understand why this makes sense. But even though we put that together, it was still confusing for some people. I don't know why, but the bottom line is Oxford proved that it, again, that's just another proof. But we have lots of evidence of it, and yes, it does work. 90%. There's not another therapy for COVID that's 90% proven. We'll know what happens with the vaccines a year from now, but we don't know what the future holds with vaccines. We have no precedent with these vaccines to COVID for humans. They have used COVID or coronavirus vaccines against animals, but you're not hearing about those results in the news. People should research that. But there is no track record of success with the vaccines a year down the road. I hope there is. But we know there's no hoping. We know facts. Over 90% of the patients that are treated early, like Alex has been doing, with budesonide, according to Oxford, would not even need urgent care visits, emergency room visits, hospitalizations. What would have happened in Odessa, Midland, if the hospitals weren't overwhelmed and they didn't need all these mobile morgues that they were reporting at one point, the overworked hospital staff? What if 9 out of 10 people that went into the hospitals didn't go statewide? And so we don't have a randomized controlled trial proving that masks and social distancing work, for instance. If there was, you would have heard about it. Oxford didn't prove that, but Oxford did prove that budesonide early treatment can not only save lives, but even keep you out of the hospital and out of the urgent care center in the emergency room. I think that's and save your life. You know, if you're not sick enough to go in the hospital, probably you're going to be all right. And so we have people who have list some of the comorbidities that you've treated, Alex. I've seen everything that a human can have, but what's been your experience as far as these people? Many of them are very sick before they ever got COVID.
Yeah. So of that 2,800 patients that I've treated, 71% of them had hypertension, which is high blood pressure, which in the early days was noted as a comorbidity that puts you at very, very high risk for mortality with COVID. And so I have seen that with early treatment, not the case. A lot of patients that I treat have type 2 diabetes. I wasn't able to run the statistics on that, unfortunately, last night, but it is, a high majority of it. They do very well with this inhaled steroid. With diabetes, just a side note, steroids will drive their blood sugar up, so we have to be very careful with that. And budesonide does not. It's a very, very low opportunity for that because it's such a specific targeted steroid because we're hitting the lungs directly. So trace amounts of it may potentially drive blood sugar, but it does not drive it up like a systemic steroid, like a pill that you would take per se. I've treated patients that have just one lung. I've treated patients that have one kidney. I've treated patients that have had, bowel issues, things of that nature. So it's been very successful. I had one patient most recently that was effective, had renal cell carcinoma, so he had one kidney, was on dialysis, and basically, the doctor told the family, this is a tough case. He's got COVID. We've met the end of the road. And fortunately, I was able to get a hold of the family. And now this patient is still dealing with his other comorbidities, but he did not die from COVID. He was treated for COVID. He did not die from COVID. And so, we're not going to give up because of certain comorbidities. But yeah, that my most concerning patients, I think, were the ones that come to me and say, "Oh, by the way, I only have one lung." And I think, well, this isn't very fair for me. But they turn out and they do very well because this is a very effective, targeted treatment.
Well, we certainly appreciate you coming in. We are out of time. Alex Watkins.
Yes.
Now, they can find all your information there on budesonideworks.com. Do you want to spell
It's
that?
BUDESONIDE, budesonideworks.com, BUDESONIDE.
And you can also give Alex a call. Alex, I know you are out of Big Spring, but as I said, you video conference, so
Yes.
Let's give them that phone number.
Yes, my phone number is 432-268-3773.
Well, again, thank you so much
Yes,
for
thank
what
you.
you've done for all these people you've treated. And Dr. Bartlett, as usual, thank you for coming in and bringing Alex with you this morning. It's been a wonderful treat.
Good morning, West Texas. There is good news.
There certainly is. Thank you both. We're going to take a quick break. It's time for us to go into your